Sterilization is more than a procedure. It is the foundation of safety in healthcare. Behind every sterile instrument lies a precise process designed to eliminate harmful microorganisms and protect every patient's life. Today, we step inside the world of steam sterilization, using the autoclave, one of the most trusted and effective methods used in hospitals and healthcare facilities worldwide. In this video, you will learn the essential process, proper handling techniques, and the importance of maintaining sterility through every stage of autoclave operation. Welcome to the science of safe sterilization. Let's begin the process with precision, safety, and protection at every step. In the world of healthcare, steam sterilization is super important for keeping patients safe. You've got to make sure everything's done right. When using autoclaves, like getting ready, putting stuff in them, and following the rules, every step counts to make sure stuff is fully killed germs. Staying clean and on top of things is key when it comes to sterilization. Preparation, precision, documentation, sterilization, perfection. Now, we move into the operational handling of the autoclave system. Always ensure the door seal and rubber gasket are intact, as this is essential for maintaining proper pressure and sterilization efficiency. Carefully open the door. With proper care, firmly grasp the rack and guide it out with absolute control. Now arrange the instruments on the trays correctly. Avoid any overlapping or overloading, as proper spacing is required for steam circulation. Place the trays securely on the racks inside the chamber to ensure stability and effective sterilization. Carefully arrange the instruments on the rack in a precise, structured order to protect them from damage. Inspect the internal chamber for any dust particles or contamination. The chamber must be clean and ready before every cycle, and always maintain proper hand hygiene and use full PPE during the process. Once loading is complete, close the door slowly and securely. Make sure the seal is tight and the chamber is properly locked. Next, set the required temperature and pressure according to the type of instruments being sterilized. Carefully monitor the cycle parameters before starting the process. Once the cycle is initiated, maintain observation until completion. Pour distilled water carefully to avoid contamination. Then, check and confirm the water level is correct. With the water level confirmed, then close the chamber cover securely to initiate the sterilization, and properly documented for quality assurance and compliance. Once completed, once the water levels are verified and the chamber door is securely locked, set the precise temperature and pressure required. Carefully cross-check all parameters on the digital display to start the process. Documentation is a critical part of sterilization. Every step must be recorded accurately, including cycle settings. Once the sterilization cycle is running, safely discard your current PPE. Perform hand hygiene. When opening, use heat-resistant gloves and carefully remove the trays. After the process is finished, do not open immediately. Allow the chamber to cool for approximately 3 minutes before opening the door, as they will be extremely hot. Handle all instruments with caution, using proper tools to avoid burns or contamination. After unloading, remove them very carefully with care. Remove any remaining wastewater from the system, following the correct procedure, and clean the chamber if required. When removing the wastewater, always don fresh PPE to maintain strict hygiene. Remember, sterilization is not just about cleaning instruments. It is a continuous chain of infection control designed to eliminate all risks of cross-contamination for our patients. Once the cycle concludes, The machine will generate the official sterilization report. Do not simply file this away. It is your legal and operational proof of safety. Take a moment to carefully verify the data. Check that the peak temperature, pressure levels, and total exposure time exactly match your protocol requirements. Make sure to record them carefully. Every second counts. In sterilization, and watching that clock is a matter of patient safety. We log the precise start time, exposure, duration, and completion times with absolute accuracy because these files are more than just records. They are definitive. Legal evidence. The sterilization cycle may be finished, but the chain of infection control is still active. Once the instruments are safely processed, we must remove the PPE and transition immediately to the proper disposal bin.